This is also a large trial, multi-center, multinational, mainly focused on squamous carcinoma. These are all advanced patients, metastatic disease, previously untreated, and they were randomized to pembro plus chemo versus chemo. So one comment that we all have is about the choice of chemotherapy. So this is not chemotherapy that anyone likes, including patients, but they chose that. So I think there will be some pushback on that. If the regulatory agencies insist that pembro should be combined only with this chemotherapy, there will be a lot of problems. But nevertheless, I think for the selected endpoints of squamous carcinoma with more than CPS of 10 or higher, or all squamous patients, or all patients with CPS of 10 or higher, or all patients, irrespective of biomarker, there was consistent advantage. The highest advantage was in the squamous population, especially more than CPS of 10 or higher. So we sort of anticipated this because in the second line setting, pembro and nivo, they both achieve the primary endpoints, and both drugs are approved in this space for squamous carcinoma in second line. So this is a nice progression of that observation. So I think it will change the practice paradigm for sure. And we will probably be treating, irrespective of PD-L1 status, I think you can use pembro plus chemo. As far as the adeno cohort is concerned, there are some concerns about the adeno cohort. It's a very small cohort. And it is very curious that in this study, they did not stratify patients according to CPS. They probably should have done, but it turned out that almost half of the patients had CPS of more than 10, which is a surprise. Especially in adenocarcinoma, we haven't seen that kind of number before. So there are some questions about adeno, whether you want to use nivo plus chemo, because this population was also included in Checkmate 649, or you want to use pembro plus the chemo that nobody likes. In this area of gastroesophageal tumor, we really made some progress here.